Okay, so welcome everybody to promoting self-esteem and positive identity while reducing anxiety and depression in dyslexic children. And we'll go ahead and go to the next slide. And I'd like to introduce Dr. Roberto Olivardia. He is a clinical instructor of psychology at Harvard Medical School. He has a private practice and he treats various issues, but he's very familiar with ADHD and dyslexia. So thank you so much for joining us today, and we just really want to welcome you, and we'll go ahead and get started.
Great, thank you so much for having me. So as mentioned, other than having a private practice where I work with many people with ADHD and various learning disabilities, I have a son who has dyslexia, and I have ADHD and have had issues with reading in my early childhood. And one of the things that as a parent and as a professional that I always discuss with other parents, particularly when their children get diagnosed with dyslexia, is obviously the focus is going to be on getting them to read and having reading interventions in place, which is obviously very important. But I always think that the main thing we really have to look at is self-esteem. As in my practice, when I see kids who are struggling with learning differences, learning disabilities, that really before we can even do and have them even do the work that they need to do in terms of the reading interventions, unfortunately, their self-esteem has taken a colossal hit in terms of how they feel about themselves. And if you have a child or an adolescent or an adult whose self-esteem is in a very bad place, then nothing you're sort of going to give them is going to be as helpful. It's not going to stick in the same way. So a lot of times, particularly for younger children who might be identified later on, 4th, 5th, 6th grade, when they've been struggling with dyslexia for many years, by that point it could be very difficult for them to even find themselves to be smart enough or worthy enough to even try to engage in some of the interventions that they might need to engage to become better readers. It could sometimes be labeled as uncooperative or acting out, when meanwhile it's really a self-esteem issue. So kids with dyslexia, and again, when I'm often going to be referring to more children, but this could apply as well to adolescents and adults, that self-esteem can take a hit on many different levels. So of course, academically, you have individuals who can be quite bright and intelligent, yet they're struggling, and they have, it can be very difficult for anyone to really understand, okay, if I'm a smart person or if I'm a bright person, why am I not doing well in this? I'm putting in all the effort. Why is this not sort of working for me? Perhaps I'm not really as smart as I think I am, and that's where the self-esteem around one's intellectual capacity and ability starts to diminish. Kids with dyslexia have also been known to be bullied often for their learning difference, being told that they're stupid, and these kids often will internalize that, feeling stupid, feeling different. There is a good amount of research that looks at the amount of stress that's involved for anybody struggling with a learning disability, the extra effort that has to be put into homework, to paying attention, the extra services, the transitioning of different classrooms, perhaps going into the special education classroom for certain interventions. The school day, unfortunately, is not one that is smooth, that is calm, that is serene for many kids who struggle with dyslexia. And that stress translates into a lot of anxiety, not just around school-related things, but it could be anxiety about a lot of different things. I mean, when you feel like what you put into something, you're not able to get out of it, you start to develop a level of anxiety around that for other things, and thinking, okay, well, I don't have any prediction as to the amount of effort I might put into this. I can't predict what I'm going to get out of it. So if you learn that very early on, which unfortunately many kids with dyslexia do, it can make them very anxious to take on challenges in other things that have nothing to do with reading. Unfortunately, I see a lot of young individuals who are depressed because of not only academic failures and these self-esteem issues, but just a general feeling of worthlessness and a general feeling that if I'm not smart, if my effort doesn't count, then what's the point of doing anything? What's the point of life? What's the point of living? And I do see people where it gets to that point where suicide doesn't seem like a big leap for them in terms of feeling like they don't have any major positive impact in the world. So the feeling of inferiority is that's the single most important thing we really have to protect these kids from in understanding their learning disability. So how do we begin to do that? So I came up with this acronym called the COPE model, which refers to 4 different aspects of which I'll talk about in more detail. So we have creating a healthy philosophy about emotions, operating a shame-free, judgment-free mindset, promoting self-esteem and self-advocacy, and encouraging authenticity. So what I mean by creating a healthy philosophy of emotion is these are, again, individuals who, despite all of the effort they put into things, aren't getting out of it. Dyslexia, unfortunately, is often not recognized until failure starts to set in, and we as a society have to do a much better job at really identifying and assessing these children as young as we can, and we can, as young as kindergarten, begin to screen for dyslexia. But if these are children that really struggle with these issues, they might end up hiding them or masking them. And there is a huge price at suppressing emotions, that the lessons we have to teach children is that we must feel our emotions in order to cope with them, even when it's a bad emotion. I mean, no one wants to feel sad. No one wants to feel frustrated or angry. However, it's very important to feel the feeling, to engage with the feeling in order to then cope with the feeling and then have it be something that we could successfully get past. We're never really going to get past an emotion unless we feel it. So I always use the analogy of, if you're walking down a road and then there's this swamp, and that's the only way to get from one piece of land to another is to walk through this swamp. It's going to be muddy, it's going to be messy, you'll get dirty, but if you get through the swamp, you can continue on your journey. And that's what we need to do, versus just staying there on the piece of land saying, oh, I don't want to get into that messy swamp, but there's no other way to get to the other side. We need to get through that. There is a tremendous amount of energy in emotional suppression. When kids suppress the stress and the anxiety, there's a large price that they pay for that. And I always tell parents or educators that it's very important. A lot of kids that I know with dyslexia or individuals with dyslexia can compensate quite well through being very socially charismatic or being very humorous, being the class clown. But we don't want to underestimate that beneath that could be a tremendous amount of emotional suppression, of feeling like failures, feeling not good enough, and often feeling like they have to be socially charismatic or else people won't like them. And it's great to be again, we can use some of those things as coping skills, humor and being socially charismatic, but we want to make sure that that's not sort of just the defense to all of these suppressive emotions. When we numb a negative emotion, we're numbing a positive one. That emotions run like the Christmas tree lights, where if one light bulb burns, they're all going to burn. Our emotions don't run like the strand, where if one bulb burns, the rest of them are working just fine. So if we train ourselves to never connect to feeling sad or never connect to feeling our anxiety or our frustration, unfortunately, we're going to start numbing the parts of ourselves that can feel happiness, that can feel joy. So it starts to create, and that's where depression really starts to set in. Depression is not sadness, it's actually the absence of emotion. It's the absence of feeling anything. And that is a much worse feeling than feeling sad, because to feel nothing is almost kind of disconnecting us with what makes us feel human. So when we suppress an emotion, we actually create an uncontrollable expression of that emotion. So if we're feeling anxious, if we don't speak to that anxiety, or if we don't deal with that anxiety becomes panic. And panic attacks, for those of you who may know, is an uncontrollable feeling of anxiety that can result in these attacks that almost can look like heart attacks to people, where they have absolutely no control over their anxiety. Anger, sadness can, if suppressed, can become depression or rage. Rage is not anger. Rage is actually what happens to us if we're not in touch with our anger, and it starts to kind of just fire blindly. As we operate a shame-free, judgment-free mindset, the emotion that I see most in kids who really struggle with their self-esteem with dyslexia is the emotion of shame. And shame is a devastating, corrosive feeling. And what shame is feeling bad about who you are or who you think you are, versus guilt, which we might feel bad about something that we did. Shame is much more pervasive. If we feel like we're not worthy, or if we feel stupid, or if we feel like nuisances, if we feel like bothers, then that is how we start to define ourselves, and it can lead to individuals numbing themselves, avoiding situations, or withdrawing. And so the suppression of emotion really leads to a suppression of the overall self, which often really gets in the way of developing that authentic identity that we all look to try to do throughout adolescence. So it's so important, again, to get in touch with these feelings and understand that if there's shame there, that we address the shame as quickly as possible. We want to promote self-esteem and self-advocacy, the idea that no one is superior or inferior to you. And, culturally, I'd like to say we live in a culture that promotes that, but we don't. I mean, I think that you often will see people looking at other people in very hierarchical ways, but it's very important, this idea that although you might not be a competent reader per se right now, at least, that doesn't mean that you are overall inferior, that there are going to be things that you can do that other people might not be able to do, or things that take little effort for you that could take a lot of effort for other people. And that, particularly if kids are feeling stressed, or if they break down crying, if they're frustrated, that they shouldn't feel shame around feeling that emotion. Particularly, boys that I work with feel a tremendous amount of shame crying, and boys are often socialized to not connect to those emotions and are more socialized to connect to feeling anger. And with a lot of the girls that I work with, it's the opposite, that a lot of them who might feel very angry don't often assert that or voice that, and it might come out more in sadness. All of us are vulnerable to a breaking point given specific circumstances. So the idea that one is weak, we want to throw that right out, that there's no such thing as that. All of us, if given specific circumstances, all of us, if we had to go to school, if we had to go to work in which we felt like we were just incompetent and failing, would feel awful about that. That makes complete sense why someone would feel that range of emotions. Dyslexia is not about low intelligence. It's not about willpower. It's not about morality. It's really, it's what we know as a neurological learning difference, and it's very important for kids to, as young, and I'll talk a little bit more about how to talk with them about that, but it's very important for them to understand at a very early age that it is neurological, and not the idea that it's a bad brain, that you can talk about it in a way to say, look, this is how, the brain of someone with dyslexia works, and this is how it works for people without dyslexia, and it's not that one is a bad brain and the other is a good brain, it's just a different brain, and so now that we understand that, we have to figure out what is the best way to teach your brain. And I think as early as you can, I mean, once a child gets diagnosed with dyslexia, and my son was diagnosed right before first grade, and it's like runs through my family, so I wasn't surprised, just knowing the genetic rates and such, that it's very important to develop what I call an IPP. So we know IEPs are individualized education plans, and IPP is an ignorance preparation plan. That even at 6, I remember saying to my son that because of this learning difference, that people are going to think that he's not smart. And I said, we know, though, that you are, and we know for a fact that you are. I mean, he did a bunch of neuropsych testing, but even if you don't have the neuropsych data, say, we know that you're a bright person because of X, Y, and Z, and you can name some things. But unfortunately, people associate good readers with being smart people, and people who might have a hard time reading with not being so smart. So we have to prepare like what you would say, and we did role plays where I said, let's pretend that you're in the classroom and you have to read something, and somebody says, oh my gosh, you can't read? How would you respond to that? Now, I told him that most of the time, people, at least at that age, most of the time, people are not even going to mean it maliciously. They're probably just going to be genuinely surprised, because my son in particular has a very good vocabulary. So when you talk to him, I think it would be surprising for people, again, who associate good readers with good vocabulary. So we had a response to say, how to say it back, to say, oh, no, this is actually difficult for me to read because I have dyslexia, which is a learning, my brain just learns differently, which makes reading a little more difficult, but these are the things that I'm good at. And sure enough, I remember it was probably 3 weeks after we discussed that he was in a music class in school, and they had to read the words to a song, and he couldn't read them. And this girl said, what do you mean, you can't read that? And he knew she wasn't being mean about it. She was just shocked, like surprised, and he said that to her very calmly, and she said, oh, okay, and that was it. And then how do we prepare for when people might be a little bit more, or might be malicious about it, because that will happen as well. Sometimes people are going to say those things that are not so kind, and how either do you say something back? Is it worth saying it back to them? But most importantly, to make sure that I know as your parent that that's being said to you, so that we can talk about it. And then if it's something that I need to talk to your teacher about, or the administrators about, or for that child's parents about, we can do that. So really having that open communication and letting the child know, preparing them that that will happen. I think a lot of times, and I understand that parents want to protect their kids and not have their kids think that those things are going to come down the pike, but they're going to come down. They're going to experience that, so it's better to have them prepared for that. Now, probably one of the most important things that parents ask me is about the idea of the label, the word. Should we use the word dyslexia? I don't want my child to be labeled. Now, personally and professionally, I'm in favor of using the name. I think that a name is very, very important for, well, one, proper diagnosis of a name is certainly important for treatment and remediation and interventions, but also labels can validate to people that they're not the only ones. I know, as someone with ADHD, that having that term and going into the scientific literature and seeing that there's a whole scientific literature about people who have my kind of brain was extraordinarily validating to me, to know that, okay, so I'm not the only person, that in fact there are a lot of successful people with this, and I just have to figure out how to work it. The key is you need to define that term for them before somebody else does. Dyslexia, as you all probably know out there, is so wildly misunderstood. And people, if you poll the majority of people, people will still think it's all about letters being read backwards or words being read backwards. And although that can affect some people with dyslexia, that's not the majority of people with dyslexia. To really define it to them, to the child, but also to people around you, people in your family. Educate people around you that this is a term that we can use almost in a more empowering way. Unfortunately, if we call it something else, if we say, oh, it's, we don't want to use the D word, the dyslexia word, we, choose to use this other word. Well, what happens is that eventually, if the child, they start to hear the word dyslexia, they might unintentionally feel more shame that that word was never initially used. It's almost like, well, if there's this term, dyslexia, why wasn't that used? Oh, maybe it was so bad that, my parents didn't want me to think that I had this, because it was such a terrible thing, so maybe I should feel ashamed. And of course, that's the last thing that parents want. I mean, that's what they're trying to prevent. And so it's very important, again, to use the name, to use the term, because, again, it will be defined. They know that they're different. I mean, parents will say, I don't want my child feeling different. They do. They know that they are. I mean, my son knew in kindergarten when he had a hard time reading the word the, when it was presented to him just a few words before, and the child next to him is reading fluently. He knows that something's different. I mean, reading, it's not like, some of the other issues that, people might have, which you can kind of hide in ways with reading. It's all around you. And so the child knows they're different. Give them a context now where you can say, oh, yes, your brain might be different, but only from these people, but it's not different from this group of people who also have dyslexia and who are achieving and who are very successful, but they had to figure out a different way to do it. So education is huge. A label it can be very empowering, and we don't want it to limit oneself or deny accountability. So a label is not, oh, you have dyslexia, therefore you don't have to, try as hard. Well, of course not. With the child, you say the power of this word is that it has given us a different recipe that we can follow, but we still have to put in effort. Just like people without dyslexia have to put in effort for their kind of brain to achieve and to succeed and to do well in school and to do well. So now that we have this word, it actually gives us a greater responsibility. We don't want to deny any accountability. And the E is encouraging authenticity, the degree to which one is true to one's own personality, spirit, or character despite external pressures. True self-esteem and confidence stems from being authentic. The more authentic we are and we put ourselves out to be, the higher our self-esteem would be. Because if we're not authentic, even if we get positive feedback from other people, it will not get absorbed or internalized. If I pretend that I'm, really good at knowing a lot about robots, for example, and you say, wow, Roberto is so smart, he knows so much about robots, and I know secretly that I don't, then I'm just going to feel like a fraud. So it's very important to encourage for kids to be their authentic selves and find people who really affirm that authenticity. There is an identity that comes along with being dyslexic. There is I know in the ADHD community, the first time I went to an ADHD conference, I felt like I was with my posse. I felt like I was with my tribe of people that just shared a similar sensibility. And many people, as for those of you who probably know, about 50 to 60% of people with ADHD have a learning disability. And the majority of those people with learning disabilities have dyslexia. So there's a high comorbidity between ADHD and dyslexia. And there is a certain identity. So it's this idea, again, of viewing dyslexia in very accepting ways of this is the way my brain is wired. And it's as simple as that, as opposed to this doomsday diagnosis that when people hear about the kids that drop out of school or the kids that act out, those are children, unfortunately, that haven't been either gotten the interventions that they need and where their self-esteem wasn't sort of attended to in the ways that it might have needed to be. Dyslexia in and of itself doesn't cause all of these terrible things. It's how people think of themselves, and of course it's the services and the interventions that people are getting that really then make it either something that someone could thrive with or something that could be responsible for a lot of failure in their life. So again, introducing the terms, don't shy children away from it, and have positive models of others with dyslexia. If you Google, you all probably know, lots of entrepreneurs, celebrities, inventors, writers, authors, athletes who have dyslexia. And it's important for kids, whoever they're a fan of or whoever they like, to see that there are people who also have dyslexia who can succeed, and it gives them another face because they may not know. Some kids don't know one other person with dyslexia except whoever else is in their family that has it, and chances are that one of the parents do, that we know just genetically speaking that is a very, very high likelihood that if you're dyslexic as a parent, that you're going to have at least one child with dyslexia. For ADHD, it's about a 70% rate. So if you have ADHD as a parent, there's a 70% chance you'll have a child with it. And with learning disabilities, it's very high as well. Emphasize to them the positive features of this kind of wiring, that although it's frustrating, the reading, and it can be so difficult, this same kind of brain that could be responsible for so many frustrations is the same kind of brain that also can lend itself to being creative, to being very intuitive and imaginative, to think abstractly, to be very flexible and entrepreneurial. And that flexibility and that abstract thinking is neurologically based. I mean, what we know about the dyslexic brain is that we have the left and the right hemisphere of our brains, and people who do not have dyslexia, there's an asymmetry of those hemispheres, which means that one of them tends to be larger than the other, is more dominant than the other. With dyslexic brains, it tends to be more symmetrical. So in the sort of frustrating ways, what that means is that there's sometimes an over-communication of sort of neural communication between the two hemispheres that almost creates too much noise, where you don't, like, you want the letter B to be a B sound, and it's that simple, that linear, as opposed to having too much communication. But that same communication also lends itself for people to think in ways that are very outside the box and are very abstract, because they're communicating in different hemispheres of the brain that other brains might take a lot more effort to do. And it's, again, no wonder that many entrepreneurs, for those of you who are fans of the show Shark Tank, that which we love the show Shark Tank, 3 of the sharks on Shark Tank have dyslexia. And I think that's important, again, for people and for children to know. So parenting your child, assume that they are trying the best they can, even when they are not overtly giving it their best shot. And trust me, it's hard. I know that that can be hard at times when you know that your child might not be giving the best effort, but it's, again, keeping in mind that particularly when they're in school, they're putting in 180% effort, and by the time you see them at the end of the day to do homework is just, are you kidding me? They're just done with it. And I sort of put myself in that shoes and think, okay, if fortunately, I love my job. I'm very passionate about it. I feel very competent about it. But I imagine if I went to work and I hated what I did and I felt I wasn't good at it, and I was getting constant feedback that I wasn't good at it, and then I had to come home and someone told me I had to do more of that work, I'd be miserable. I mean, who wouldn't be obstinate? So it's very important to just kind of hold that frame, and that doesn't mean that we're going to be perfect parents and every time we're going to hold that frame, but even if we can hold that frame more times than not, it'll be very helpful in the relationship with the child. Understand that most parents are diagnosed with dyslexia when their child is. So there's also something to be said about, if you're the parent with dyslexia, what is evoking in you when your child also has it? Are you more in sync with them, or is it very difficult because maybe you dealt with your dyslexia in a very different way? Maybe the nature of your dyslexia is very different, so you might assume that what worked for you works for them. It's hard to know. Sometimes the parent without dyslexia has a very difficult time grasping and understanding it, but sometimes they might actually be the better fit, let's say, in doing homework because they have some more distance from it. Their own, they're not. It's not evoking for them sort of their own memories of what it was like having, or what it is like having, a learning difference. So it's for couples, it's important to just discuss that. Sometimes it doesn't make you a bad parent if you're not the better fit to do homework, let's say, with your child. It might need to be the other parent, and so that's important to assess. Empathize with them. Sometimes parents will say, hey, look, I had ADHD, I had dyslexia, I got through it. Well, it's important to let your child know how you got through it. What are ways, be specific. Even when we don't think our kids are listening to us, they're listening and they're absorbing that. Support, and make sure as a parent you're getting support for yourself. It could be a very arduous process going through IEPs, if you're seeking out-of-district placements, just doing the homework battles, communicating with teachers. I mean, there's a lot of energy that's expended in advocating for your child, and it's very important that you also get support for yourself, whether it's other parents who have children with learning differences, whether it's something like having exercise or getting a massage or doing something that sort of soothes you so that you can be your best at advocating for your child. And again, that self-esteem and mental health really is the #1 priority. That I remember telling my wife when my son was diagnosed that, the reading intervention we'll figure out, but the most important thing is that he can't see himself as a person who's incapable of learning or a person who's incapable of doing very good things because of the dyslexia. Because once you have that in place, then we have a real big problem. So that's so important. Now, unfortunately, as in my practice, as I mentioned, I see many kids with dyslexia who struggle in many clinical ways. So the first category is the mood disorders. And when we're talking about our clinical depression, and where it's more than just sadness, it's more than just feeling blue or down. By what we mean are these warning signs. So when we're talking about sadness, we're talking about very frequent bouts of sadness or very angry outbursts, especially out of context. So it makes sense if your child just lost a baseball game and they're going to be very upset about it. But if it seems like there's no context to it, that's an indication that the child is suppressing a lot of emotion, and it's just literally just bursting open, like they can't contain it anymore. And it actually is a good sign in some ways. It's a better sign when you see those sort of emotional outbursts. Where it gets, when you know it's really in the danger zone is when they're flat, like when there's no emotion, because that means it's almost like a fuse has been blown, and that's almost in some ways what depression really is when the fuse is just completely blown. But for a lot of kids, their depression can be manifested through being very angry. When they don't find pleasure in anything, even the things that they once found pleasure in, is a very concerning red flag. So of course they might hate doing homework, but if you find that video games, which they always love to do, they're like, I don't even feel like playing video games, very, very important to get help at that point, because once the things that typically give them pleasure don't anymore, then that means that they're disconnecting from everything. Social isolation on a continuous basis, even when there are opportunities to be social. If a child who especially has been social before is preferring to be by themselves, it's because they're feeling so bad, they're feeling like they have to be a fraud, that they're hiding the energy it takes to maybe hide all of these inadequate feelings that they're feeling. Certainly when you hear quotes like, I hate myself, I wish I was dead, all very, very big red signs. Now, for a lot of children, they might not express it in these sort of more emotionally articulate ways or more psychological ways. It might come out in more physical ways, like somatic complaints, chronic stomach aches, headaches, things like that don't seem to have any organic cause. It's not like they just ate something that makes them sick. Certainly school refusal, which I would say probably 80% of kids that I've treated over the years who have school refusal issues have learning disabilities. So there's definitely a high correlation. Again, if school is stressful, if you feel like you're failing at it, who would want to go? I mean, would any of us want to go to a job in which we felt chronically inadequate from? Certainly major sleep or eating changes, sleeping too much, sleeping too little, eating too much, eating too little, you want to be aware of. And what we call grandiosity and devaluation, that sometimes even kids who are depressed might sort of swing from sometimes feeling almost over-important in a way that they're like, oh, I'm better than everybody, in this sort of superiority kind of way, which is not healthy either, because the more superior someone feels or the more narcissistic someone might feel, it's really masking them feeling completely devalued. So kids, let's say, who might not be competent readers might find, like, let's say in sports, if they're good at sports, that they're like, yeah, I'm better than everybody else, I'm the best athlete in the world, and it's clear that it's almost like they're compensating for the decreased self-esteem that they have in their academics. Any regressive baby-like behavior, certainly like being in a fetal position, thumb sucking, and parents, I always say it's almost like you know it when you see it, like when you see behavior that's like, oh my gosh, like I haven't seen this since, the child was 2, all warning signs for mood disorders. When we look at the risk factors for depression, we have loss, abuse, and that includes bullying, maternal depression, parental criticism and conflict, stress, social alienation, and learning disability is actually one of the risk factors for depression for kids. And when we look at some of these other factors, kids with learning disabilities are also subject to bullying. They're subject to a lot of parental conflict, either between them and the parent, and sometimes between parents who sometimes might have a lot of arguments as to, is the child trying hard enough? Is it the disability? What to do about it? Sometimes criticism from parents, stress, social alienation. So all of these almost all of these risk factors can also be, are all something that can be loaded onto the learning disability variable. The other group of disorders are the anxiety disorders, and we worry when a child is constantly worrying, especially about the future. So not worrying about the tests that they're having next week, that's, fairly common, especially for kids with dyslexia who perhaps, may have to, and may have to worry from the perspective that they have failed tests, in the past. But when you start hearing things like, I'll never succeed, I'm worried about whether I'm going to get into a college, I worry about will I have a job, I worry whether, I remember working with a kid who is 8 years old with dyslexia, and he had these obsessive thoughts about whether he would be homeless when he's older because he couldn't imagine that he would ever be successful to own a home and to have a family, and so his self-esteem was in a terrible place. Obsessive thoughts that are intrusive or interfering. I also specialize in the treatment of obsessive-compulsive disorder, or OCD, and again, with any comorbidity is important to address. So if somebody has OCD, in addition to dyslexia, that the OCD can take on sort of some of, almost feed from the dyslexia. Again, the somatic complaints that you see in depression, you'll also see in anxiety disorders, particularly migraine headaches, IBS or irritable bowel syndrome, gastroesophageal reflux disorder or GERD or acid reflux, and stomach aches. Those are the bigger ones that you'll see with anxiety and stress. Ulcers, kidney stones, which I've seen even in younger individuals, typically correlated with anxiety. Rituals to reduce anxiety or neutralize bad thoughts. This we would see with people with OCD who might engage in certain compulsive rituals to manage their anxiety. Perfectionism, kids who are highly perfectionistic, sometimes as a way of compensating for their learning disability, and avoidance are all signs of anxiety. And when we look at risk factors for anxiety for kids, and this is in no particular order, but one of the variables, again, we see is learning disabilities and academic difficulties, genetic factors, perfectionistic traits, stress, medical illness in the family, shyness, any traumatic event, and poor sleep are all risk factors for anxiety. So what can we do to sort of begin to kind of address this? Well, there are some proactive ways. Now, a lot of times parents might ask their children, oh, how was school today? And most of us probably get good as the only response. I like to be more specific, and I ask my kid, I also have a daughter who's 8, and I ask my children, tell me 2 good things about your day and 1 not so good thing. And that could be a very good way, a very specific way where you're hearing some of the good things that happen, but also a way that is letting you in on some of the things that might not be so good. Versus if we said, did anything bad happen in school today, they might be less likely to reveal that. But if that's couched and in a sense overshadowed by the two good things, because we really want them to take away the 2 good things, but we also want to hear about maybe the not so good thing. And that's when you might hear about how so-and-so was teasing them at kickball, or how the teacher was stern with them about something, or how they were frozen trying to take a test and they couldn't ask for help. All those things become data that you could sort of take in as a parent and then talk with your children about. If you see behavior of them, any of these warning signs of mood and anxiety, comment to them on what you observe in their behavior. So it's not, I think you're anxious or I think you're depressed. It's, I noticed that you didn't go out with your best friend Bob today, and you always like going out with Bob. What's going on? Make it very specific. Otherwise, because then that way they have to speak directly to it, as opposed to you seem sad is almost too vague. They can easily say, no, I'm not, and deny it. So you want to comment on very observed behavior. As a parent, it's important for kids to hear times, and not just when kids, you suspect that your child might have a mood or anxiety issue, but just in general, it's good for kids to hear that you have tough times, that you've been stressed out, that you had maybe, times where you felt down, and talk about it. What did you do about it? And it doesn't even have to be sort of presented in this preachy way. You could, sometimes I find, like, as I'm driving to the beach, with my kids or something, I might, I don't know, just something pops up and I'm like, oh yeah, that reminds me of, and I sort of present it very casually about how something was very stress-inducing for me and how I dealt with it and how I have to even watch some of these things today. And that's very important for kids to internalize. Like, oh, even, mom or dad or auntie, uncle, whoever is their caregiver, they can feel this way as well, and there are ways that we can handle it. It doesn't make me bad if I feel this. It doesn't make me weak. Find physical or creative means of engaging their emotions and discharging them. Any art form, music, art is wonderful. Exercise, athletics, coming up, writing. I mean, any ways for them to sort of get out and release those emotions. We never want to brush off their feelings as being a phase or drama, especially for adolescents. I mean, adolescents can be very dramatic. I mean, we all probably were when we were adolescents, but we want to make sure that we're validating the emotion, and they don't want to hear that they'll feel better with time. They need more specifics around what they need to do. To say, let's work together to make you feel happier. Not that you're going to solve it for them, because especially as adolescents, they don't want you solving it for them necessarily. They're trying to be their independent selves, but also is that we want to encourage them to be advocates. And so, but we don't want them feeling like they're by themselves and alone. So let's work together. Validate that it can be hard to even articulate feelings. Buying books that talk about dyslexia. Certainly when someone is first diagnosed, going on Amazon, finding some good books, and I can recommend some titles that are just great for kids to hear. Teaching relaxation techniques and deep breathing for anxiety, and ways of self-monitoring. So you could say, on a scale of 1 to 10, 10 being the highest in anxiety, or stress, or sadness, whatever the emotion is, what do you feel? And teaching kids throughout the day to kind of ask themselves, where am I on a scale of 1 to 10? Because if I was 4 an hour ago and now I'm at 7, what happened in the last hour? We want to challenge any negative thinking they might have, like I'll never succeed, I'll always fail. We don't want to accommodate any unhealthy avoidance. So if it's stressful for them to go to school, probably the worst thing that we could do is not have them go to school. I mean, certainly I'm all for a mental health day every now and then, but certainly when it comes to school phobia or school refusal, the quicker you can get the child back to school, the better. And certainly seek professional help sooner rather than later. There's no shame in it. And often a lot of kids who, when they come to see me, are very relieved, actually, to just be able to have a space where the only requirement that's asked of them is to release these emotions and to talk about them. And they know that I'm not going to be someone that they run into at their school functions or things like that. So they're often relieved to have that space. Obviously, Walt Disney, amazing entrepreneur, he had dyslexia himself, and one of his quotes is, if you can dream it, you can do it. And having quotes like this for children, and for any age, can be very helpful and very empowering. Sometimes maybe having it printed up and putting it on their bedroom wall or on the door every time they leave the house or something like that, to just kind of keep it fresh and have that be something that's very connected to them. So I will stop here and answer any questions people have.
Perfect. Wow, that was really good. I could relate on so many different things in there. I really loved how you talked about having the IPP too, because as parents we really focus on that IEP,
Yes.
and sometimes it's kind of fruitless, So I mean, having the IPP is just where you have your kids prepared is really a great thing to keep in mind. We do have several questions, and I'm going to go ahead and just ask you a couple here, and then we'll see what Mariah has too. So it says, now I'm not real clear, I think she was referencing something that you were talking about, but she was saying if a diagnosis is known unofficially by the parents, is it important to get an official diagnosis? And if so, what would be some of the reasons we'd need to have something officially diagnosed?
Definitely. So for learning disabilities or dyslexia, it's very important to get official diagnosis, primarily in order to get services and in order to access services. So for something like I always make the comparison for ADHD, for example, it isn't as crucial in some ways for people to get the full neuropsych testing to get a diagnosis. You can diagnose ADHD through clinical assessment and interviews without paying the cost of a full neuropsych. Where it can be helpful is for medication purposes. Now, for dyslexia, in order to get school services, to get IEP services, you often will need an official diagnosis. So typically it would be, now some people go through the school, or you can go to a private neuropsychologist who is specialized in testing and assessing for various learning disabilities. And once you get that report, if it's outside the school, you would submit that report to the school, and the school can actually determine whether they accept or reject that report. Unfortunately, there are many examples of schools that reject reports, but it's important, again, they'd have to have a very good reason why they do that. But once your child has that diagnosis, then it's the school's responsibility to develop an IEP and work with you as the parent to develop a plan of getting this child services. So the official diagnosis is often very important.
Okay. And then we have another question from a parent that says, I am struggling with allowing special services and accommodations for my 9-year-old son at his school without causing him to feel more different and dumb than the other kids in the classes. How do we get our dyslexic kids to be okay with getting special treatment or accommodations at school? Sometimes they miss out on, activities in class and stuff. How often do we need to check in with them on their emotional state about all this stuff too? Kind of a big question. So.
No, absolutely. It's a very good question. I mean, I think in terms of the checking in on how they feel emotionally, I mean, that's something that is basically as consistent as we can. It's so important to have the dialogue. Every beginning of the year, with whatever new schedules in place, how does it feel to them? What do they feel they're missing out on? The reality is that, if a child is going to get certain services that are outside the classroom, it means that they're not getting something that the other kids, in the general ed classroom, might be getting. Now, sometimes when the general ed class is doing reading, they might be pulled out and doing reading, but sometimes their reading pullout might occur during the art class or something. And as parents, you can really advocate for that in terms of sitting and saying, look, I know my child needs that art time, certainly needs the physical activity or these other things. So, you can press on them to sort of look at the schedule and try to figure out times to minimize. And part of it is asking the child, what upsets you most when you're pulled out of something, and try to prioritize to say, well, if my child has to be pulled out, obviously, they need that on one hand, but let's not do it during these time blocks. And again, if you press hard enough, eventually, schools they'll work with you on that. I mean, some schools are very easy to work with parents on that, and sometimes schools present it as, well, this is the way it has to be, and I would question that. I would challenge that. And with children, I often say, yes, it's got to be frustrating to sort of be pulled out of the classroom or going out of the classroom, or if you have an aide in the classroom. And that's where, again, it's so important for them to understand why they need to do that, that it's not special treatment, that they're getting what they need to get to access the curriculum. And the problem is that our curriculum, particularly in public schools, are designed to really appeal to a certain kind of student. And so it's important that the child understands that it's not so much that it's their problem, or that, again, that their brain is sort of a bad brain. It's just that you can't develop a way that a school system works based on everybody's individual way of thinking, so they go with kind of the majority, and the majority of people do not have dyslexia, and so they're going to go with that. So what we need to do with these services is just get you in the same platform as everybody else is.
Absolutely. Okay, so then we have another one from another parent saying that she has an 18-year-old high school senior who's 100% convinced that he's going to fail out of college, and he's in the upcoming summer between high school and college here now. She's trying to figure out what she should do. Should she work on this anxiety issue with, say, like a psychologist, or keep working on that reading and writing?
I would definitely recommend him seeing somebody over the summer to talk about that thought, because the reading and writing, I mean, when he goes to college, he can get, hopefully there are services. Most colleges have services, and in fact, I mean, there are many more options in college than you might see prior to college, because you can have note takers, you can have scribes, a lot of lectures are right on PowerPoint, audio textbooks through Learning Ally, which is a fantastic service. I mean, there's a lot of options but if his negative thinking isn't sort of worked on in that way, then it's going to be very problematic for him. So I would recommend him seeing someone, and it doesn't have to be couched again in this sort of clinical way if that's going to be a turnoff for him, but more in this way of, I want you to meet with this person to basically, get you ready for this transition, almost like a coach in some ways, to sort of, what things are going to be help, especially where you feel like you're going to just fail out of, college. What could be the things that you would need to do? And it's going to be important for him to identify, why does he think he's going to fail, and if he can list, well, I think I'm going to fail because I'm not good at this, this, and this, then it's, what can we learn now about the school you're going to in terms of their services? Make sure that he's registered through disability services, like now, months before he even goes on campus, the paperwork, whatever testing, if he has dyslexia. And what typically a lot of schools might have support groups, or might have a one-on-one contact at the office who knows all of this and can even have a conversation with him, maybe in the summertime, to say, look, we have lots of kids who have learning disabilities, learning differences, and this is what we do to help them, and they do very well, but it's what is his accountability and what he needs to do. So I think that having that aspect coupled with meeting a therapist can be very helpful.
Mm-hmm. Absolutely. Okay, so we have another good one here. My son pretty much avoids his awareness of all spelling and reading problems, but lately my husband and I have noticed that he cries very easily. What do you think this could mean?
Yeah, I mean, that's often what you'll see with kids, is that, as children, we don't always have, we don't have the same kind of abstract way of thinking about emotions as we do when we're adults, and even as adults, we're not always perfect at it. A lot of kids with dyslexia might compartmentalize the feelings that they have around having the learning disability, or in some ways, either deny it or downplay it, like, oh, it's not that much of a problem, or, oh, it doesn't really affect me, but we notice it coming out in these other ways. They might, in this case, cry more easily, or they just get enraged over the littlest thing that might not work for them, and basically it's almost like they're not in touch with those other things. So maybe part of the conversation is, getting him, talk about, oh, we notice that you're upset, about this thing, and make it about whatever the thing he's upset about. Let's say if he's, I don't know, playing a video game that he lost, and make it first about that, and have him talk about that, and then in the midst of that conversation to say, yeah, that's got to be really frustrating. Are there other things that are frustrating you too? Because I know that sometimes when I feel really sad, sometimes I feel sad, and it's almost like it's more than one thing that might kind of contribute to it, that might make me feel sad, but it's almost like there's then the thing that kind of pulls it over the top, and that might help you. And then also asking him just on a consistent basis, how was your day, what's something you liked about your day, something you didn't, and you'll start hearing sort of these frustrations or these things, but he might have a hard time even admitting it to himself.
Yeah. Okay, and then we have another question. It says, my son is adopted from China, so I don't exactly know what he's feeling, but he doesn't want to learn. And he'd rather be just on the phone playing games, 24/7. He's got a low self-esteem. He does play ice hockey and he loves that, and that helps him with his self-esteem. But how can I help him to build a desire to learn?
Yeah, it's a very good question. There's a wonderful book called I believe it's called Mindset, and I'm blanking on the author's name, but it's actually a very good book about this sort of issue of the kind of mindset that we need to be in to think of ourselves as good learners. Now, part of that is you always want to start with what they enjoy doing and what they feel they're good at. And so in this case, actually, I just remember the author's name is Carol Dweck, D as in Daniel, W-E-C-K. It's a fantastic book called Mindset: The New Psychology of Success. And starting with the hockey and the intelligence that it takes to be a good athlete. I mean, we often don't give that enough credence in terms of all the sort of brain power that goes into being a successful athlete and a good athlete, and trying to link it to how there are aspects of mathematics in hockey and all these other things, and is hockey something that he would be interested in doing or playing, and is he not interested in learning because he feels like he's not good at it? It might be also having him learn things, but through a different modality. Even if he's watching like the Science Channel, for example, and it's watching television, but it's something that he's getting education from that might sort of spark some sort of interest. Like, you're always trying to look for that spark of interest. What is the thing that they light up a little bit more about when they talk about. But definitely if there's, again, self-esteem issues, it's probably worth him really talking about with someone, because kids who, when they get to that point where they just have almost given up on learning, they've almost written themselves off.
Okay, and we're getting close to the end here, but we have just a couple more I'll try to get through real quick. There's another one here that says, whenever I... Oh, wait, that's not the one I wanted to get. I have a bunch of them here, but... Where'd it go? They roll very quickly as I'm reading them, and I can't find them again. Okay, so basically the question, I can't find it right now, but it was saying, we know that dyslexia is something that's going to be with these kids for life, but
Yes.
so is anxiety always going to be there? So it comes in waves of severity, but is this going to be something that's going to go on with them forever? And she says, can we have enough coping mechanisms just to help them cope, or is this something that's going to always be there?
Well, with anxiety, it depends. I mean, there is situational anxiety that if a child learns coping mechanisms around, doesn't have to be something that's sort of part of their life. But then there are individuals. I mean, we all have various genetic predispositions, and one of them might be anxiety. So if anxiety runs in the family, that might be something that the person sort of has or has a predisposition to. So like anything else, it's just important to know how to manage and how to work with that. So it doesn't mean that they're going to be impaired by their anxiety, but it does mean that during periods of stress or during certain circumstances, that might be something that sort of pops out more. Whereas there are some kids where their anxiety is completely and totally about the learning disability, the dyslexia, and if that were out of the picture, they would they wouldn't be anxious people. But you're right in that, the idea of even, there is no cure, for dyslexia, and nor do we want to promote that way of thinking. It's really about taking the parts of the dyslexia that aren't working for us and working with them and getting the right interventions and strategies, and capitalizing on the parts of the dyslexic brain that might be working for us and that we want to capitalize on to sort of get us more towards our goals. So it's, again, painting that this is a brain we want to keep, but every brain has parts of it that have baggage attached to it, that sort of have hardship attached to it.
Right. So then we have another one real quick here. So this one mom says that every time she explains to her daughter that her behavior's, wrong, then her daughter refers to herself as Bad Annie. And she says that she wishes she wasn't born and that her mother doesn't love her. What would be the best way to try to give her some constructive criticism without causing her to melt down. What is?
Yeah, it's so difficult because they, even though you're saying it, as a parent, obviously she's saying it in a very loving, constructive way, but dyslexic kids, they're so vulnerable, and sometimes they're not always getting criticism in a constructive way from teachers or peers or other people in their life. So it is very sort of tough waters to sort of go in to say, okay, I love how you did this, this, and this with the project. So you always start with sort of the positives of what you like about it, and to say, so I could give you some suggestions as to things that might sort of help it in the same way. It's always good to have like another set of eyes. Like and again, I think it's important to bring it to give them a context that this isn't something that just they need, that you as a parent, need an extra set of eyes when you might be working on a project too. And let's work on this together and understand that if if we have to double check something that doesn't make there isn't a moral issue around this. There's no bad or good around this. But it is important that if you have dyslexia, that we know that spelling, for example, might be difficult. It is difficult for a lot of people with dyslexia. So if we know that and we accept, okay, this is what it is, then I might need to always double check my spelling. Other people might not have to, but I do. And that's where, again, this acceptance comes in. But again, it's removing the shame from it, which it sounds like this poor girl has a lot of, which is, got to be heartbreaking for her mother.
Right, right. Okay, last question. We've always told our daughter that we don't care, what kind of grade she gets on her test as long as she's doing her best, trying her hardest. But now at 11 years old, she's refusing to study for tests, and she says, "Well, I don't really care what kind of grade I get."
Mm.
It's kind of flipped. So how can we get her to really understand that she needs to put that effort in?
Yes, and you'll often see that sometimes with these kids who might initially be very perfectionistic, and then they end up failing and realizing that their learning disability is getting in the way. They can swing the pendulum in the other direction of saying, "Oh, whatever, like I don't care." The key is to really help them connect to what are the things that they want to do in life, and how doing and studying for this test is part of that journey. That even if they know they're never going to do geometry or pre-calculus, you could say, yeah, maybe you're never going to do this, and in the scheme of your life, this one class might not feel like it matters, but it's the idea of how do you get through something even though you're not crazy about it, even though you don't think you're going to get 100% on it. How do we get through it so that it doesn't present as an obstacle for you to get to wherever it is you want to get? I mean, that was sort of like my motto in high school. I remember a teacher saying to me, Roberto, you're not someone who likes to be told what to do, which I don't, and you don't like to have doors closed on you, which I don't. I want to have whatever options I want. So she says, you just got to get through this. And even though, because I was always complaining how much I hated high school, and I found the classes so boring and so tedious and hard, and especially math was a big problem for me. And she said, you just got to get through it to get to the next step. And that was very helpful. I mean, it was almost like it was so common sense in some ways, but such an epiphany at the same time. Like, yeah, I don't want, like, I have to get through this somehow. I don't have to be an A student around it, but I need to get through it. And so, again, helping her. And then if there are ways, again, services and ways that the school can help with that in some ways, talking to her teachers could help her, maybe giving her some positive accountability around that.
Right. Well, this has just been an awesome webinar, and we have a couple things that we're hanging out here in the chat box, but nothing really too important, but some people wanting to pick school, stuff like that. And we do have parent services at Learning Ally, so you can call in and make an appointment to talk to somebody, and we can help you analyze your school choices and, just try to make the best decisions as you move forward. This, like I said, has just been so much information to kind of process. I think that it's really cool, though. A lot of people could really relate to it, and I think even as parents, I saw some comments as like, wow, this is the same stuff my kid has or is going through, and I think it's important for us to all realize that a lot of these kids just have exactly the same issues. And so, again, just reach out to us. We also have another webinar for youth coming up on Saturday and another one on Tuesday. And these are student-to-student webinars. So we have teenagers that are presenting This one will be about technology, so they're going to present on technology. And that's a great way for these kids to kind of, like Dr. Olivardia said earlier, like he was with his posse. For everybody to feel like they're part of that group is really important. So, sign your kids up. It's filling up really quickly. I want to thank you once again for doing this webinar for us, and I really look forward to trying to do some more with you, because this is just really important stuff that we need to understand.
Oh, and thank you for having me. It's been my pleasure, and I would be very happy to do another webinar again.
Oh, awesome. Okay, great. We'll definitely be looking forward to it. And everybody, just have a great day, and thanks for joining us.
Thank you.
Okay, bye-bye.